The second organization that makes up the healthcare ecosystem that we should spend time on today is the TPA, the third party administrator, because a lot of times individuals get these confused with the network. And sometimes the TPAs, they are owned by the network. But I'd be curious, what are you seeing nationally with TPAs? Where are employers winning and where are some losing with a TPA?
Yeah, and this is really interesting because I think there at least, in the 10 years that I've been working with employers around, how to build healthcare ecosystems, the TPA gets usually the least amount of focus. Today, I would say what we're seeing is employers and health plans in general are starting to put more and more focus on the TPA due to the interaction from employees. What we do know is flexibility, it really depends on the TPA. And that goes back to the conversation earlier of when you start building a program and employees start engaging with it, what are they engaging with? And who are they engaging with? And the third-party administrator, they don't just pay claims. A third-party administrator that just does the blocking, the tackling, they pay claims, they adjudicate claims, they review large claims sometimes. That is really a thing of the past. And what we're seeing today is this transition, I would say focus from TPAs, focused on those things, that's playing stakes now, to really being, how can the TPA be the conduit for a high-performing healthcare plan? And a lot of that comes down to flexibility, transparency, strategy from their end, and then their team, the people side of it. What do they have internally that they can help you build? What do they have from a clinical standpoint, from a program standpoint with infusions and J-codes and all these different tools that we're seeing TPAs now really be the center point of how those get utilized. And if an employee isn't extremely comfortable with their TPA and how they can help them, we typically are seeing these programs and solutions fall flat. So again, part of it goes back from that, high level behind the scenes, the low level, and now you're dipping into with the TPA and employees interacting with that third party administrator. How can you find and work with the right TPAs? And there's many of them out there that are doing a great job. How do you find and vet those options to ensure it's a good fit for what kind of plan you're going to build? And it goes back to some of this is regionalized, some of it's localized, but ultimately what we're firm believers in when it comes to TPAs is finding one that is privately held, they're transparent in how they're being compensated, and they're willing to be flexible. If we find those three things in a TPA partner, we typically are seeing them be the ones that employers are extremely happy with and employees are extremely happy with because their focus is on the patient.
Completely agree. And something employers, I think, do often is they'll say, hey, I want to start to slowly break apart my healthcare ecosystem. I've heard about self-funding. I've heard about getting away from being fully insured and working with one of the big carriers. So I still want a network, as we talked about, using one of the big carriers as my network so employees can access care. But a TPA, I think I want to step into using a different TPA. So I'm going to use a TPA that's owned by one of the big carriers. And I think this will be a step in the right direction. What we found is, yes, in the right situations, that may be a fit, and just ensure that you're doing the due diligence, right, to make sure that works for your organization. But the other side of that is you're really picking a program that's very similar to staying fully insured because your TPA is also owned by your carrier, and it's going to operate very similar to if you still were fully insured. Those incentives won't be fully aligned with you as the employer. It's not going to be 100% transparent. You're not going to be able to see where every dollar of your program is going. And if you're okay with that as a stepping stone, that's great. Dive in and learn all you can before moving to one of those independent, privately held, fully transparent TPAs. Also, sometimes what we're seeing is employers may think that those large national publicly traded TPAs are easier and better for their employees. There's two sides to this as well. They pay claims faster. That's a fact. Are they checking those claims for accuracy, ensuring that those claims don't have any duplicate billings, that there's no errors in charges, not as much as a private independent TPA is. An independent TPA, they're going to also serve as a concierge for your employees. They're going to help walk them through their healthcare journey and help them find the highest quality, lowest cost provider. There is a little bit more engagement coming from your employees using a privately held independent TPA. And like Brandon mentioned, it's all around, okay, where are we at today? What are we looking to accomplish? And what can we slowly implement to get there? So again, a lot of options when you're looking and exploring TPAs. There's not one that we believe that's a one size fits all and it works for everyone. You got to make sure you're doing your due diligence as an employer, looking at all your options and picking what is best for us, my company, my employees, and where we want to go long term.
And like everything in this space, it's something that's changing rapidly. We're seeing consolidation, we're seeing technology, we're seeing change in leadership, and I'm really excited for it because, again, the TPA is the first point of contact for an employee, and how they engage with the TPA is paramount in whatever the rest of the program is trying to accomplish. And really, what we're seeing is those TPAs that are flexible, but then are building integrations and growing and making it seamless for employees. That's really where I think groups are winning from an employee engagement standpoint. And ultimately, what we're seeing pop back up is basically these healthcare plans where you're building an ecosystem that is, at the end of the day, it's integrated with the right partners, that a group that aligns with a group's risk appetite, that aligns with what they're trying to accomplish long term. It really is a focus on a health plan versus health insurance. So I'm really excited for this space. I think it's changing fast. I think competition is good with everything. And it's something that I think we're just seeing everyone kind of rise in this area. But it's an area that you constantly have to be looking at, vetting, and before you make any change, figuring out who's the right partner, because it is a key piece of the program. And it's not something that you do want to remove or change often, because it does create disruption with those changes.
Yeah.